Good morning.
Good morning. Thank you for the introduction. It is a pleasure to have the opportunity to talk this morning about breast cancer, especially in October, which is Breast Cancer Awareness Month. So I'm just going to go briefly about some particular points about breast cancer that is worth keeping in mind. So, let's start with what is breast cancer. So breast cancer is cancer that starts in the breast, and cancer is known as uncontrolled cell growth. So it is estimated that 1 in every 8 women will develop breast cancer in her lifetime. And for 2020, it is estimated to have 276,000 of new cases of invasive breast cancer and 48,000 of ductal carcinoma in situ, which is stage 0. Is it also important to know that in the US, we have over 3.8 million survivors of breast cancer, which is great. So what are some of the risk factors for breast cancer? Well, some of the risk factors are related to hormonal exposure. For example, if a woman had her period early and went into menopause late, that meant that she had more years under the exposure of estrogen. Also, if the woman never had kids or no breastfeeding history, also is associated with overweight or obesity in postmenopause, physical inactivity, and alcohol consumption, particularly if it's more than a drink per day. So that's why we always encourage, healthy lifestyle to keep up a good weight, and then to stay physically active. Of course, in the middle of this pandemic, that has been one of the limitations that a lot of women are facing to try to keep up with a normal lifestyle given the restrictions. So there are other reasons that a patient may have high risk of breast cancer, which are related to genetic mutations. For example, if the patient is known to have a BRCA gene, like BRCA1, BRCA2, those are the most common, genes associated with an increased risk of breast cancer. There are others like PALB2 that can also increase the risk of breast cancer. Also, if there's a family history in a first-degree relative of breast cancer, then there's an increased risk for the person to develop it. Now, how is breast cancer detected? The majority of breast cancer is detected through screening mammography, which means before the patient has any symptoms. So basically, a woman goes for the yearly mammogram, they find something, and then, it turns out to be breast cancer. So the good thing about that is that because it's diagnosed before any symptom has developed, it's diagnosed very early on. Other times, breast cancer is diagnosed because a woman feels a lump in her breast, or because there's nipple discharge or bloody nipple discharge, or the breast changes in shape, in size, and there's redness, swelling, dimpling of the skin. Sometimes it can present with a lump under the armpit. So if any woman has any of these signs of symptoms, it is important to seek medical attention. And then how is breast cancer diagnosed? For the most part, through needle biopsy, which a sample of the mass of the lump is taken and is sent for pathological analysis. So once we have that information, then we know which type of breast cancer the patient has, and then we know how to move forward. Because breast cancer is just a general word, but there are different subtypes of breast cancer, and the treatment that we offer is based on that particular subtype. You may have heard that, the hormone-sensitive tumors, where the hormones play a role in the development of breast cancer and are also the most common. You may have heard about the triple negatives, which are an aggressive subtype, the HER2 positive, the triple positives. So yes, under the umbrella breast cancer, the different subtypes, and each subtype is treated differently. That's when sometimes people talk. They say, "Oh, but I had this or I had this." So it may be a little different because of this particular subtype, and also the stage of breast cancer. So the stage of breast cancer has to do with the extent of the disease at the time of the diagnosis. It's going to be based on the size of the tumor, whether or not the cancer has spread to the lymph nodes around the breast, and whether or not there's disease outside the area in a distant place, for example, the bones, the liver, the lungs, which is the more advanced stage, like stage 4. Most of the cancer actually diagnosed when it's localized to the breast, and that has to do in part because thanks to the screening mammography, because again, it's detected early. Then around 29% is diagnosed when the breast has gone to the lymph node, and then around 6% when the cancer has already spread, to a distant part. So uh, about the treatment of breast cancer, it's going to depend again on the subtype and then on the stage too. But normally involves having different doctors and different procedures. And it's actually a lengthy treatment because it involves many steps. Um, Commonly, or, patient gets diagnosed with breast cancer, they see a surgical oncologist, and, they proceed with the surgery, and the surgery is going to be based whether, depending on the size of the tumor, whether or not it's a genetic mutation, and, patient's preference too sometimes. So after surgery, the patient meets with a medical oncologist. I am one of the medical oncologists, and we are the ones in charge of, offering based on, the type of tumor, the chemotherapy, the endocrine therapy, the targeted therapy. So we are the ones that take care of that. And we stayed in the long-term relationship with our patients because the follow-ups comes with us for the long term. And then the other specialty that is involved is radiation, and they're in charge of the radiation whenever it's indicated. It's a multidisciplinary team because we have genetic counselors. We have here at Memorial Cancer Center, we do have other services like integrated medicine that help us with management of potential side effects from the treatment. And we have psych-oncologists, and then we have image recovery. So we have a lot of supportive services that, make it's important while the patient goes to the treatment of this breast cancer. So that's something to keep in mind. So breast cancer and COVID. So what has happened this year? So this year has been very particular because of the pandemic, right? So at some point, the places to obtain mammogram were closed, and then they were only open for emergent cases. And then in other instances, nobody wanted to go and get a mammogram because nobody wanted to have, the risk of getting COVID-19. So a lot of the mammograms actually have been postponed. And as a consequence, here at the Memorial Cancer Institute, the breast cancer diagnosis have decreased by 40%, and nationally, like 51.8%. So, that's concerning because cancer doesn't stop. And then we know that with mammography, we detect cancer early. And the concern is that, with all of this happening, then there's a potential risk that we're going to be diagnosing cancer at a more advanced stage, and that could be related to poor outcomes. So that's something to keep in mind. So what we're recommending to our patients is that, I think at this point, we are already in October, we have learned about COVID, the precautions, here at Memorial, everything is in place. They have the hours of operation and the sanitizing of the equipment and the social distance and the mask, everything is working properly so the patient can feel safe to go and have their mammograms. It is important to do it. I went myself and I had a great experience, and I do encourage my patients to go and do it. And for that reason, because again, mammography, it's, cancer can develop basically in any part of the body, and we only have screening for certain cancers. And breast cancer, which is the most common cancer among American women, is one of them. And it's as skin cancer, breast cancer is the most common. And we do have a screening test. And then early detection has to do with better outcomes. So, if a cancer is diagnosed very early on, maybe a stage 0, the treatment's going to be very different if it's a stage, for example, 3, when, everything is going to be involved, like chemotherapy and surgery and radiation and everything that we normally offer. So I think that for this month, it's important that, like we do keep up with our screening mammograms, and it's recommended once you're 40 years old. If the patient has dense breast, then normally, in addition to the screening mammogram, an ultrasound is done for additional testing. And for some particular cases, MRI of the breast is included. So for example, patients get mammogram, and then 6 months later, they get an MRI. Now the MRI is not for everyone. It's only for those patients that are considered to have greater than 20-25% lifetime risk of breast cancer, or if they have a genetic mutation. So in some particular cases, an MRI is added. And of course, it's always important to be familiar, to have your breast feel. And then if you notice any changes, then to seek medical attention promptly. So basically, in a nutshell, that's what I want people to keep in mind when we talk about breast cancer. So if you have any questions, you can let me know and we can discuss. I'm here for you.